Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. We're announcing our 38th death due to COVID-19 today. This is a male in his 40s in the Winkler District. This is a previously announced case with underlying medical conditions. I'd like to extend my condolences to family and loved ones. This is three COVID-19 deaths since October 13th, and I'd extend my condolences to all their families and friends as well. Our current 5-day COVID-19 test positivity rate is 4.9%. We have 173 new cases of the virus have been identified as of 9:30 a.m. this morning, bringing the total number of cases to Manitoba at 3,098. There are 6 cases in Interlake Eastern, 3 cases in Northern Health Region, 8 cases per Mountain Health, 23 cases in Southern Health, and 133 cases in Winnipeg. There are 1,527 active cases, 1,533 individuals listed as recovered. There are 25 people currently in hospital, 5 of which are in intensive care, and the number of deaths due to COVID-19 is at 38. Lab testing yesterday was 2,117, bringing our total number to 217,878. The YMCA in Thompson has 5 cases linked to the facility and has moved to critical red status on the pandemic response system. The outbreak at Maplewood Manor in Steinbach is considered over, and the facility has moved back to yellow on the pandemic response system. Certainly the numbers of cases in the Winnipeg metropolitan region are concerning, and we've prepared a graphic that can show some of the consequences of social gatherings. So the graphic shows that the impact from a single case on September 11th at a social gathering where people were exposed to someone with COVID-19. So a case linked to that gathering was identified 4 days later, and by that time they had 13 close contacts. On day 5, there were 5 more cases and added 49 close contacts. By day 7, there are 9 more cases and 96 close contacts, including 1 case alone that had 50 close contacts. By day 12, there are 40 cases and 243 close contacts, all linked back to that one initial exposure. Contacts were in the range of ages 10 to 86 years old. 2 of the contacts turned cases were over the age of 50. And we can see the significant impact of just that one exposure. 40 people infected, 243 people had to self-isolate, meaning they had to miss work, miss school, and added to the workload at public health, added a workload of testing, all from that single night. So, I think this shows that we have a long ways to improve to get back to those fundamentals. We can see that this is not, this transmission event is not from having a couple contacts. These are large gatherings, large amount of contacts, and we can see how quickly that builds up. So we've moved the Winnipeg metropolitan region to restricted or orange on the pandemic response system, and we put restaurants, further restrictions on restaurants and bars. And these concerning cases continue despite that. So we are going to need to look at more strict measures. We've talked about the fundamentals. Many Manitobans have been following those fundamentals from the beginning, but we can see we've lost our way with the fundamentals at this point, so we're going to need to act to be able to bring down these numbers before continued escalation. So we have another chart on our dashboard showing an extremely high case count in young adults. It shows a rise in cases of men and women in their 20s. Number of cases in both these age group now higher than any other age group in the Winnipeg region. These cases rose quickly in early September with a number of outbreak settings which accelerated that spread. Over half of the cases aged 20 to 29 have an unknown source of exposure. About a week after the 20 to 29-year-old spike, we saw an increase in cases in people over 60. So remember that no one's risk is their own. We might see this spiking in certain age groups. That's just for now. It won't be contained in those age groups. It will affect everyone if we see ongoing transmission of this virus. We have announced 11 deaths since last Thursday. And again, these underscore the need to protect those that are most vulnerable to this virus. Older Manitobans or people at any age with underlying medical conditions are at higher risk for severe illness, and the more community transmission that occurs, the more at risk they are. And so this is why we all have to take steps to reduce the spread of the virus. Even if you perceive your risk as not extremely high, your risk is not your own. We spread this virus to our loved ones, to other parts of our communities. And we all know what we need to do. We need to reduce the amount of contacts we have. We can see from that graphic that certainly didn't occur on that occasion, and we have multiple examples like that. Reduce the amount of contacts outside your household. Stay home when you're ill. Wash your hands. All that physical distancing. Very, very important, and we can see the consequences of not doing that. And so we need to definitely make a change. Added to the fundamentals this time of year is getting your flu shot. And so we know we're going to see circulation of multiple respiratory illnesses. For one of them, which causes a significant amount of morbidity and mortality, as well as demand on our healthcare system, influenza every year, we have a very safe and effective measure to protect ourselves against that, and that's that flu shot. So I encourage all eligible Manitobans to get that flu shot this year. So again, visit our website, manitoba.ca/COVID-19 for up-to-date information, and I can open up to some questions.
You give an example of where somebody was symptomatic, and you provided us with some data on how many infections resulted from that. Do you have any data that tells us what proportion of total infections have started with a symptomatic person going out into the community?
You know, it's we probably don't have that level of detail on it. We just know that that's just an example of things we've seen. We've seen large family gatherings where we've had 23 contacts in a day, and someone was symptomatic there and resulted in multiple cases and multiple people needing to self-isolate. You've heard of the one we talked about with the a younger person going to multiple bars in the same night and the next day while symptomatic, and that's probably countless contacts really on those ones. So there's multiple examples, and we see that probably the majority of that age group are similar to that. Multiple contacts. We've seen the median amount of contacts, number of contacts right now in wave 2 in the Winnipeg area is about 4. Which is close to double what it was in the first wave. Of course, we had many restrictions on there, but the range is, like we saw, up to 50.
So you're seeing multiple examples where people are going out symptomatic and causing spread. You don't have the exact numbers on it, but there are multiple examples of that?
Multiple going out to social events, multiple going to work.
Where they're symptomatic?
Yes.
They're symptomatic.
Yes.
Dr. Roussin, you said we're going to need more restrictions. What are they? When are they coming?
Well, we're in orange, and you saw that when we went to pandemic, the response level in Winnipeg and the orange level, we tailored our approach much like Prairie Mountain Health. Because we're seeing widespread community-based transmission, that targeting approach is much more difficult now, so you're likely going to see a wider spread orange in the Winnipeg metropolitan region. So we don't have the details of each sector, but in the pandemic response system posted online, you can see what orange will look like for multiple sectors.
Okay, but can you please, you're saying this is for, are you saying, forgive me, the release hasn't come out yet, so I'm trying to parse your words. All we are going to be restricting restaurants, retail, gym, other things?
It could in fact affect that. We're looking, I would say, expect widespread capacity limitations across multiple sectors.
When
But we're
will you
not going
announce?
to red.
We're not going to red in Winnipeg as a total. We're still looking at certain sectors. We're looking at personal care homes, where we're going to place them all in red restricted to just up the level of protection for all of those. But we're certainly not going to red for the Winnipeg metropolitan region. We're going to just
All these
expand.
years, will we red?
That's right, in the Winnipeg metropolitan region, yeah.
So Dr. Roussin, we've had 3 straight days, obviously, of record case counts. When Winnipeggers and Manitobans will want to know when these new restrictions, if not go into effect, will be announced.
Yeah, and so, I mean, I don't have details. I would expect that to occur tomorrow or very early next week.
Speaking of Parkview Place, because it's horrific, to be frank, with 80, if you know fewer than 89 infections there so far. What is public health doing to ensure residents there are being taken care of?
So public health is in the outbreak investigation and provides recommendations on a number of issues. So we're in close contact with case investigations, appropriate isolation. So that's right from the beginning. That's not unique to Parkview. That's in any of the PCHs. They of course have their own infection prevention and control. The health region is in close contact with them. And so there's a lot of hands on deck working on that at Parkview right now.
Did you yourself go inside?
No.
Okay. What did you hear about the conditions? Could you substantiate claims made by opposition MLA yesterday that people are lying on their own feces?
I can't comment. I haven't been in there. I certainly haven't heard those reports.
There was a grievance brought forward by the union saying staff working in the COVID units, like the floors with the COVID patients at Parkview, were not being provided N95 respirators. How can we, what can we say about that or about the control of the outbreak there when staff aren't necessarily being given the proper.
So you should be given the appropriate personal protective equipment. If we're not talking about aerosol generating medical procedures, then the N95s aren't indicated. So I don't know the specifics. I haven't seen that grievance, but I mean the statement that appropriate PPE has to be provided is absolutely correct.
Dr. Roussin, what's the test positivity rate for the Winnipeg area?
5.8%.
5.8.
So that exceeds what, like, the standards for test positivity rates globally. Like 5.8 is where the WHO would say we need to put restrictions in place today.
Yeah,
So
and
what should Manitobans be doing in this?
yeah, well, remember we have restrictions in place, right? So it's very likely this number would be much worse if we didn't have restrictions in place, and we are going to be moving in very short order to further expand those restrictions. But like we said in the right from the outset, is you don't need to be restricted by an order to take the proper steps to protect yourself and the people around you. So like we said, there's actions that each Manitoban can take right now to reduce their risk. And you don't need to wait to see if an order requires you to do that.
Dr. Roussin, just on testing, we're hearing more reports of spoiled test results. I know you said that this is rare, but just to your knowledge, how often does this happen, and what options are available to people who that does happen to? Can they kind of get fast-tracked back into testing? Because we're hearing just some cases of people waiting hours, the test result gets spoiled, they have to wait hours again and take another day to go get.
Yeah, it's a rare happening, but remember when we're doing thousands of tests a day, even rare things then start to pop up in absolute numbers. But it's not unique to COVID testing. There's sample issues, and again, not unique to COVID. Samples get mislabeled, samples sometimes leak, and so in the practice of medicine, we will often have to follow up and get those tests redone. It's unfortunate, but in a system where we're running thousands and thousands of tests every day, you're going to expect some of those things. As far as what they can do, we are moving towards hopefully that more of an appointment-based program to reduce those limits, because I agree, if you went and submitted a test, it's of no fault of your own that it leaked, it happens, but we'd want to try to provide a simplified approach to get a retest for them, and that probably the appointment-based system would probably help with that.
Getting back to Parkview, how often have officials been inside that building?
Well, I don't know the specifics of that as far as officials go. I mean, we have a licensing branch that would do that. So, we'd have to ask those groups.
How are you ensuring there's enough workers there? I know you've changed the rule, allow people to come and go, but I can imagine some workers are reluctant to go in there. So how do you get them in?
Yeah, well, that's the region is working with them, and so public health. Can't really get too much involved in human resourcing and staffing, so the region is working with that. Public health can relax some of those orders, like you mentioned, to try to limit that impact anyways.
And on that note, when people leave there, how do you ensure they're not potentially taking COVID to another care home?
So we have precautions on that. So any care home that is, and so people, do you mean a resident or a staff?
Staff.
Well, staff would certainly, staff in that direction is still under the one site rule. So somebody leaving Parkview isn't exempt from anything. They would still have to wait 14 days before working at another site.
The temporary, you changed the one worker, one place rule to allow people in.
Only in
so-
the one direction.
Only in the one direction.
Yes,
Ah,
yes, yeah.
thank you.
Yeah.
That wasn't clear. Would the province consider providing its own workers to the building if this continues, or Red Cross, or Army, like we've seen in Ontario and Quebec?
Yeah, I mean, that's, I can't comment on that. I think that when we're dealing with, in the pandemic, we've, looked to multiple ways to address the kind of issues, so I don't think I would take anything off the table, but I can't speak specifically to that.
Can you give us an update on the other personal care homes? I know we requested that list on Tuesday. Sorry.
Let's see. I don't. So, yeah, I don't have a reported change in any of the others that we've been following.
You know what Heritage Lodge is up to?
12.
Still, okay.
Dr. Roussin, can you give us any indication as to why Parkview has had such a severe outbreak? What are your investigations telling you about how staff are moving through the building, how residents are being cohorted, or how they're in fact moving through the building? It's just growing at such a
Yeah, well, I mean, it's absolutely concerning, and we know, we knew in the first wave that we have to do whatever we can to keep this virus out of these situations, because once it's in, we can see transmission easily, and then obviously severe outcomes in this population. So it's a large PCH, so when that virus gets in there, then you could also expect a larger amount of people to be affected by it. But I don't think there's anything specific to that personal care home that I could comment on that's driving transmission more than what we would see elsewhere.
Then how do we stop it? We don't know what's.
Yeah, well, I mean, a lot of these are in, that came out were in the similar incubation periods, right? So their exposures all occurred around the same amount of time. So we'll see cases develop, within that. And so how do we stop it? We do the exact same thing. We focus on case identification and isolation. We ensure that people aren't coming to work while symptomatic, hand hygiene, universal PPE. And then we'll see that outbreak starting to come down.
Dr. Roussin, would the additional restrictions have any effect on schools and childcare?
Well, so we haven't landed everywhere, so for the specifics, we would say, what I would say is that we're not seeing a lot of transmission in those settings. And so we know the big benefits, especially of childcare and being in school, especially for the younger children. So public health hasn't listed those as really concerning areas. And so we'll land on some details, but we're seeing a lot of cases in school, but those are acquired in the community. And so once we pick them up, we're not seeing a lot of transmission within the schools, which tells us that the plan is working.
Other than the 140-year-old male who had no underlying conditions, were there any other deaths where underlying conditions were not present?
No, not that I'm aware of. They all had, the average age is quite high for the deaths, and all of them but that one that I'm aware of had underlying conditions.
Rosen, I have one more question on Parkview. So at this point, public health has not visited the site to ensure that the outbreak protocols are in fact up to snuff.
Yeah, public health typically doesn't visit personal care homes, so we have, there's licensing and standards that can do inspections and things. Public health will be in contact with these facilities regularly, and like I said, too, the region is working quite closely with the home.
What is the number of cases related to Headingley at now?
I'm not sure if it's unchanged, 7 inmates, 2 staff.
Okey-doke. And we have, we asked about hospital capacity. Could we get a little bit more detail of that? You said on Tuesday, we're doing fine in hospitals, but obviously with high case numbers, the hospitalizations tend to lag. Where are we at with acute care bed capacity and whatnot?
So, I mean, we're still in what we would say is in green in our dashboard. And so the specific capacities, there's other strains always on the healthcare system. Like we said, we've trying to get caught up on the elective surgeries that were delayed during the first wave. So there's certainly pressures on the acute care system. We're not seeing that pressure right now from COVID with this number of admissions. But like we say, there could be a lag for it, and like we always say, the big goal, the number one goal when dealing with the pandemic is to reduce morbidity, mortality, and the strain on the healthcare system. And so it's not necessarily just focused on absolute numbers of cases. It's the severity of the cases and the burden of the healthcare system.
Is there, what is the latest health links wait time and test turnaround wait time?
Search those. So average wait time is 95 minutes at Health Links. And the total, median total test turnaround is 41 hours.
Improvement?
You're seeing fewer average daily visits to hospitals of people with respiratory issues compared to the last few years, which is good news in terms of hospital capacity. Do you have any, do you know why that is?
It's likely that the precautions that we take against COVID also reduces the transmission of those other type of respiratory viruses. And so we're still fairly early. The respiratory virus season is on its way. We haven't seen much of other viruses. There's some rhinovirus out there, but not to high levels right now.
Is that an important factor that you look at as one of many when you're looking at to bring in more measures, for example?
It is for a number of reasons, is because we can't differentiate COVID from those infections without a test. And so people are with symptoms are going to have to be isolating pending results at least. And so that's going to affect testing capacity, as affects our healthcare system capacity if we have healthcare workers needing to stay home when it turns out they just have rhinovirus. So it's, respiratory virus season is going to be challenging. What's working in our favor is that all of the preventive measures, the fundamentals, the restrictions we have in place are likely to benefit transmission of all those other respiratory viruses as well.
And why are kids playing hockey in phase 3 and exposed to as many as 40 people when group size is below 10?
A lot of the things we do are based on, risk and benefit. And so getting the kids out active is important. I think that with the newer set of restrictions, we are going to be looking at sporting activities. I think we want to definitely find ways to be able to continue them. But things like further restrictions in crowds, even on benches, ensuring there's more distancing and people just paying more attention. So it's always about trying to find that that balance.
Dr. Roussin, can you give us more details about the event that person attended for that gathering that they attended where the cases just kind of, you know,
Yeah, well, that particular one, no, it's described as a social event to me. But I can give you, we've had multiple ones that are large family gatherings, multiple family gatherings. We've had, bars. We've had, it's certain other type of, gathering of friends and family.
I wonder what are your thoughts on, you said some folks went to work while symptomatic, so how do we talk to those people who are, trying to balance their paycheck against their health?
Yeah, right, and that's, we've always talked about that we're not stigmatizing anyone, right? This isn't about blaming anyone, and there's real challenges. So in the summer we started saying, plan for increased absenteeism, for employers and for families. Certainly for my family, that's quite easy to accomplish. For other families, that's much more difficult. But employers, if you don't have anything in place to, make staying at home easy for your employees, the alternative to that is your employees are coming to work sick. And that's not good for, for business or for your capacity either. So it's, like we say, it's no one's risk is their own. To employers, to employees, we have to do whatever we can to keep symptomatic people at home.
Have you seen any examples where symptomatic people were going to work?
Yes, plenty.
Yeah.
Yep.
So it's not just the social gatherings, bars and family gatherings. There's also many examples of where people have gone to work symptomatically.
Correct.
And are there examples of where those people were serving at a restaurant?
I'm not aware of anything as specific as that. I just know that we've had multiple examples of employees heading to work while they're symptomatic.
I wonder, what
Thank
are
you,
your thoughts
Doctor.
on-
We're going to go to the telephone now. We have a number of reporters waiting. Up first, from the Thompson Citizen, Ian.
Hi, Dr. Roussin. What triggered the decision to move the Thompson WCA to the red level in the pandemic response system? Just the number of cases, or?
Yeah, that's right. If we, we saw active transmission, so we felt that it was a clear outbreak. It's in a bit of a setting that that puts it at increased risk of more transmission events. So we felt it would be important to declare an outbreak and change it to red.
And what kind of, measures are put in place as a result of it moving to that critical level?
Yeah, would limit people in and out. We'd have more isolation going on. We've certainly enhanced testing in that area and an enhanced environmental cleaning.
From the Brandon Sun, Emily.
Hi, Dr. Roussin. I guess my question is, what would it take to move Winnipeg to level red? To level red. I know that the pandemic response system classifications are based on a number of different factors, and that not all of them are included at all the time. But is there some kind of indicator that comes to mind as to what would trigger moving Winnipeg up to that critical level?
Yeah, so if I had to pick if we looked at one indicator that could trigger that, despite the other indicators, would be a strain on the healthcare system. So if we saw a avert strain on hospital beds and ICU beds, then that could trigger a response. It would have to take multiple other indicators to do that, and then also time. We're going to expand the orange very shortly, and so we're going to have to see what that does within an incubation period or so. If we're not seeing progress, then we'll have to take further action, which might be red. It might be certain sectors going red. Those are some of the things we're looking at.
Okay, and I guess my follow-up question is, do you know of any connections between the 8 new cases that were announced in the Prairie Mountain Health Region today? That's higher than we've seen in a while. So, yes, is there any connection between those cases?
Yeah, I don't have details on those cases, probably still ongoing public health investigations.
From CHVN, Taylor.
Hi, good afternoon, Dr. Roussin. Recently, parents in southern Manitoba presented to the Garden Valley School Division why they believe they should have the right to choose whether or not their kids can or have to wear masks in school. How do you feel about giving parents the ability to make that decision?
You know, again, it's we're not here to stigmatize or to, to call out any groups. I think masks have benefit, and so that's why we've, mandated them in schools. We mandated in Winnipeg metropolitan region. So I encourage everyone to wear those masks. It's the same messages that our risks are not our own. So if we feel, we're more likely or more able to take risks individually, it's not your individual risk, it's other people's risk as well. So we are in this together. Masks are just an add-on to try to reduce the spread of this virus. We see what's happening in our province right now. We want to keep the schools going. We want to have the economy open. So we have to put measures in there so that we can do all those things to reduce the transmission of the virus. So my message is, consider the benefits of the masks, and that we're all in this together. And so we know that some people can't wear masks, and so we don't want to stigmatize them. But as a group, Manitobans, I'd really encourage the vast majority of Manitobans to wear masks when appropriate.
Thank you. And along the same lines, how do we change that culture of going to work and school when we're sick?
It's challenging because we've all done it. I've done it, right? It's just that I can't do that now. So I think repeated examples of it, repeated examples of where it's now caused many cases. It's caused many contact investigations, a lot of testing. And so it has huge implications for us. And now that type of behavior is largely responsible for now we're going to need to even restrict our economy further. And so I think we all want to be in a place where we don't need restrictions. And staying home when we're ill is going to get us there a lot faster. So we just have to find ways to deal with this. We know what to do. It's just really tough to do it all the time, and it's really hard not to lose our focus.
From City News, Stephanie.
Hi, Dr. Roussin. On Tuesday, we saw positive tests being retroactively added to days on the weekend. I'm just wondering, are we still seeing a backlog in these tests being reported as positive? In other words, are today's numbers accurate?
That's right. Yes. So as of Tuesday, that backlog was caught up. So we're not seeing the backlog today.
Okay. And just as a quick follow-up, the test positivity rate a few months ago was less than 1%, and you really described it as really not a large concern at that point. The test positivity rate now is 4.9 across the province, 5.8 in Winnipeg. How would you characterize that?
That's quite it's elevated. It's much more elevated than we can certainly tolerate, and so that's why we need to act with it. So we've had restrictions in. We put restrictions in response to lower test positivity rates than that. But now when we see this positivity rate now similar to what it was in Prairie Mountain Health when we ended up putting Prairie Mountain Health into orange, we know we need to act both through public health interventions, but also through our messaging, and that this is a clear message to Manitobans that we have to change what we're doing right now, or else we're going to see the ongoing transmission of this virus. We're going to see increasing test positivity rates if we don't get back to those fundamentals.
From CJOB, Will.
Good afternoon, Dr. Roussin. We've heard from a number of people who are concerned. They have complaints because they say their employers are demanding to see a negative COVID test result before they're allowed to return to work. Now, I understand your expertise is health, not labor laws, but could you just give us your assessment of that? Is this fair? Is this a reasonable tactic?
Well, yeah, I mean, what I'll talk about is the systemic problems with that. And so if we really want to reduce asymptomatic testing. So that's number one. So any business right now that is demanding asymptomatic testing on people, unless it's under the specific guidance of public health, I would ask you to discontinue that practice. Our testing measures are already strained, and so we want to be able to focus on symptomatic people or people who have been directed to under by public health. So that would be my first concern with that policy. The rest is we have to try to find ways to get through this together. So I think employers should have ways of having ill people stay at home. And so if you can manage that, then you're a step ahead. You don't need to see negative swabs because only people who are asymptomatic are going to be attending work. So we don't want symptomatic or sick people attending work, even if they have a COVID test. And so there's a number of things put in place. I think it's a real challenging time for everyone, for employers. We're moving to even further restrictions, and we know so many businesses have been adversely affected by this pandemic. But we have to share the burden, and we have to try to, each play our role to try to get through this.
Okay, thanks for that. And kind of jumping off of that then, how would an employer or an individual, how can they be sure they no longer have COVID? Is it a time frame thing? Is it a symptoms thing? Combination of both?
It's public health. So if you're a confirmed case, public health will be in contact with you daily, and public health will let you know when you can come off isolation.
From the Winnipeg Sun, Scott.
Good afternoon, Dr. Roussin. Can you confirm that schools, especially in Winnipeg, some of them as of next week will be targeted under orange or red under the pandemic response system?
Well, I'm not going to confirm, the details of it. I think what I say is that schools right now have public health's worked a lot with schools, and they're doing a tremendous job and working quite close with public health. So we haven't seen a lot of transmission in those areas. So certainly as we see more and more transmission in the community, we're going to see more and more cases in school. Although the measures put in place have decreased the level of transmission anyways within the school. So I'm not going to confirm what the measures will be, but we'll continue to work really closely with education on that.
Okay, thanks for that. And just as a follow-up, we talk about everybody's got to do their part and all that stuff. We're seeing a lot of deaths, a lot of cases, and people not, flouting the rules that are affecting a lot of other people. What else is going to be done other than a widespread lockdown that's actually going to get people to comply? Because we saw that in the spring, given how it was then, and now, how do we get back to those types of numbers without putting in those similar restrictions?
Well, I think that the messaging and these numbers are going to change behavior. As Manitobans see these numbers climb like this, it's going to change behavior and get us back on track. I do think that we need to, focus more on enforcement as we move forward. I think we need to ensure we have the adequate ability to enforce, and it is something that we're looking at right now.
From CBC Radio Canada, Laisa.
Hi, Dr. Roussin. My question is regarding the proactive cases. Are any of the new cases announced today and yesterday retroactive from previous day? And if so, could you provide information on those retroactive cases and what would be the net increase for the last 24 hours?
Yeah, and so I think that, from my knowledge, this is the 173 that we announced today is the net number for today. I'm not aware of any backlog.
And how do you explain the retroactive cases that were announced yesterday?
Right, yeah, and so that was just a bit of a backlog at our epi and surveillance unit, and so they have to enter the positives into the system to get announced, and so they had that backlog over the weekend up to Tuesday, and so now caught up.
Thank you, Doctor. We have a few minutes left. We now return to the news conference theater.
Doctor, what do you have to, go ahead.
What is your thoughts on how our COVID situation compares with jurisdictions like Toronto, for example, Quebec, just 2 weeks ago had a 5.8 test positivity rate. What are your thoughts on how we're doing compared to areas that have greater population density, more cases generally?
Yeah, I mean, I think it's clear that we're in a second wave, that this is the second wave of the virus, and we're seeing it to the east of us. We've seen some to the west of us, some increasing cases, and I would expect that we're going to see increasing cases throughout most of the nation over the next number of weeks, and so I think it's just like in the first wave. And just like in between the first and second waves, there'll be variability between jurisdictions. We'll see some jurisdictions very high and then start trending down, and at that time we'll see others that are very high. And so I think we're well into this second wave now, and we're going to just see that variability for the next for the foreseeable future, actually.
Dr. Roussin, what do you have to say to the family members of people?
Can you explain how you know we don't have transmission in schools?
Well, it's just we do the case investigation, so we have plenty of cases, and then we do contact investigation and then self-isolate close contacts, and so we're not seeing a lot of those close contacts as a secondary transmission.
So that's how you know that they didn't get it in the school.
That's
They must
right.
have got it somewhere else. You just don't know where they got it from.
That's right. Yeah. Well, often we do. Often we can determine where they were contacted, but some not.
And where are you seeing most of them getting it, or is it just spread out?
Same thing. Widespread community-based transmission. So contact various places.
Doctor, what would you have to say to the families are actively trying to get their loved ones out of Parkview Place and say they can't?
I don't, I think that the, public health has been working really close. We're going to do whatever we can. I mean, this is, very important for us in the region and Parkview. I can't really comment on what they've been told about trying to get them out or anything like that. I think that the only thing I would tell them is that we got a lot of people working to try to reduce that transmission, and we got a lot of people working to try to, not allow this to happen again.
Does this make you think any differently going forward as the pandemic continues about how the province will treat privately run personal care homes?
Well, I don't think right now I'd be distinguishing privately run or a regional run PCHs right now based on this. There are people who do that, so I'll leave that to their expertise. But what we say, what I would say is that it's very likely that just like in the first wave, just like in Prairie Mountain Health, we're going to see a decline in transmission again. And when we do that, we can't let our guards down again. We always have to be aware, even if we see a decreasing transmission.
Dr. Roussin, I want to ask you on that point. So if and when we get back to perhaps caution within Winnipeg, are you considering changing your strategies for school operations, for businesses as far as the restrictions or the policies that they have to work under, so we don't get to this place again?
Well, I mean, we constantly review, where we think things got wrong, and I don't think there's many specific issues. I think that if we followed a lot of the things that we had in place that we intended for people to follow, we would probably be in a better place. Although we're not going to avoid seeing cases. All right, it's a pandemic. So you're seeing it in multiple jurisdictions. We're not going to avoid that, but I do think that if we get to that place, which we will, we'll start seeing the transmission under control again. But at that time, we know that we're not done with that virus. We have to keep our guards up.
So do you think that the reason we're, approaching additional restrictions and, maybe tomorrow or the next day is because folks aren't following the rules, or because the rules are not having the intended effect?
Yeah, well, I mean, I think that we have multiple examples of people just not following the fundamentals and not following rules as well, like that. So so there's probably a bit of both. I mean, nothing you implement is always going to work out exactly as you intend. So we continue to learn with that. But I do think we just have multiple examples that we've lost track of the fundamentals.
Are you starting to fall behind on contact tracing? You said earlier this week it was becoming challenging to keep up with the new numbers and case numbers. How is that going on resources for contact tracing?
It's still very, very strained right now. I mean, we're getting to all the contacts. It's taking longer for sure, but we have a number of things in place that we took immediate steps, and we have some in the very short term that's going to really ramp up our contact tracing ability.
You say it's taking longer. Can you quantify that?
Well, it's tough. It's tough to quantify, with that. So we were, we were still, trying to get, at the first wave, we were trying to get to 90% of contacts within 24 hours. We're certainly not that, and in most regions we're still in around that 70 to 80% within 24 hours. Winnipeg, I can't really comment on just because of the nature of the way they report their contacts right now. That is in the way of in the works of clearing up as well.
But it's falling.
Yes, yeah. It's the system is strained, but we're still getting to the contacts.
What's the impact of that as that falls? It's taking longer to get to the contacts, which means they have there's a greater ability for the contacts to go out and spread.
That would be, if there was a real prolonged time to that. So, we get a positive case, we try to get that case in isolation, which they should be. Right, if you're symptomatic and went for testing, you should be isolating already. So, so we get to that person, we get to those contacts, and then try to get them isolating again, limit their amount of contacts. Again, there shouldn't be any contacts that are showing up or anybody showing up to work or going out when they're ill. So whether you're informed you're a contact or not, that just shouldn't happen. So even if we're not getting to say 90% in that 24 hours, if we follow the fundamentals, if we follow what we have set out, it shouldn't have that huge impact on it.
But it takes longer for contact tracers to find the contacts of that infected person. The longer it takes to get to the contact, to get to the infected person, the longer it takes to get to the contacts.
To contact, yeah, it's all connected that way. And then I would say that our contact investigations are much more complex this wave than they were in the first wave, right? We'd have an international traveler with very, household contacts, very simple investigation. Now you can see, think of how long it took to track down 50 contacts of that one individual. So it's much more complex now.
Dr. Roussin, following up on Billick's questions, you said you couldn't talk about the details of schools. Well, yes, there's been very little transmission in schools outside of John Pritchard. A number of students have been told about a plan to move high school students to remote learning to make more room for younger students. So you said you can't. Is this an economic plan to ensure that parents don't have to be at home with younger students? Can you please, you opened a crack there. So
yeah, so I mean, I want certainly education to comment on the details. I'm not sure if the exact details are there right now. What the goal is that we want to keep kids in school for the most as much as we can, right? And we know that the high school students. For most families, it's much more reasonable to have remote learning options, for them. We have some, many right now going only certain parts of the week. So, and then you're right, if you can get more of that, then that just frees up more space at times too. So, that's along the lines of.
How does that fit into the broader orange restrictions?
Well, it's just the more community-based transmission you have, then the more cases you're going to expect to see in school. There's probably going to be a certain amount of percentage eventually of transmission within there. And so the more robust we can make our plans, the better. So that's, kind of that approach.
What percentage of people that are being tested right now are asymptomatic?
Asymptomatic, so it's fairly low right now. You know, it's still around that 10% mark right now for that, and some of it is difficult to you know, to calculate because it matters what's actually written on the requisition. That's how we get our information. But we still have it's a fairly significant amount of asymptomatic testing.
So people are showing up who are asymptomatic for a test, you're not turning them away, even though they may not be there because they're being referred by a healthcare.
That's right. Right now, no. When we get to the appointment setting, we'd like to be screening for symptoms because, like we say, that's where we really want to be focus our testing on.
When are you going to move to that appointment system?
Yeah, it's in the works right now. I don't have a date on when that would be.
And so all testing will be by appointment?
Not necessarily. No, I mean it's there to reduce the you know, the waits, to try to streamline it. So we'd hope a lot of people take advantage of it, but for the most part, our message to Manitobans, and it hasn't really changed, is that we really want to focus on symptomatic testing. Purely asymptomatic person, no one's advised you, you're a contact, public health hasn't advised you to go get tested, we'd ask you not to get tested.
Dr. Roussin, people who own gyms, who own restaurants, are going to hear your statements today about broader orange restrictions. They're going to go, okay, now what? What do we have planned? Can you provide them with a little bit more certainty on when this will be announced and when would it go into effect so they can start doing some planning with their staff, with their ordering of things like food that does spoil? What kind of certainty can you provide?
It's very, very likely, right, early next week that these will be coming into effect.
Thank you.
Restaurants, gyms?
It's going to be broad, you know, capacity restrictions. Yep.
Thank you very much.